This is Dr. Tuncay Delibasi, an endocrinologist, clinical geneticist, MD. Today's topic is relationship of vaspin and apelin levels with insulin resistance and atherosclerosis in metabolic syndrome. Aims. We aimed to investigate circulating vaspin, apelin 12, and apelin 36 levels in subjects with metabolic syndromes, METs. Search for the association of vaspin and apelin levels with insulin resistance, IR. High sensitivity C-reactive protein, HsCRP. Carotid Artery.Intima-Media Thickness, CIMT, and cardiovascular risk factors. Methods. In this observational case control study, a total of 41 patients with METs, 30 women, and 11 men, mean age 41.3 plus or minus 9.4 years, and 39 healthy comparison subjects, 27 women and 12 men, mean age 38.4 plus or minus 6.1 years, were enrolled. Serum HsCRP, lipid profile, insulin levels, and the homeo-stasis model. Assessment of insulin resistance. HOMA-IR were evaluated. Apelin 12, apelin 36, and vaspin serum levels were measured via ELISA. High resolution B-mode ultrasonography was performed. Results. The two study groups did not differ as to age, sex, blood pressure, smoking history. Vaspin, apelin 12 and apelin 36 levels were significantly elevated in patients with METs when compared with that of control subjects. P less than 0.001. Serum vaspin levels showed a statistically significant association with CIMT, R equals 0.365, P less than 0.001, and HsCRP, R equals 0.316, P less than 0.01 levels, whereas both serum apelin 12 and 36 levels were positively correlated with HOMA-IR, R equals 0.344/0.462, P less than 0.01. Conclusion. Based on the findings of this study, serum vaspin and apelin levels were found significantly higher in patients with METs than age-matched control subjects, and significantly associated with coronary atherosclerosis. These adipocytokines might play a part in the pathogenesis of METs. Also, serum apelin levels can be used as specific markers for insulin sensitivity in patients with METs. Keywords. Metabolic syndrome X, C-reactive protein, insulin resistance, the prevalence of overweight and obesity among children and adolescents is increasing worldwide, and concordantly, the prevalence of the METs is rising. METs is an important public health problem in Turkey as well. The key pathophysiological factor underlying the development of metabolic syndrome is insulin resistance, triggered by chronic inflammation and an increase in inflammatory cytokines such as TNF-alpha and IL-6.5. Adipose tissue, which is a source of inflammatory cytokines, also acts as an endocrine organ that secretes adipokines. Vaspin is an adipokine, isolated from visceral white adipose tissue of the Otsuka. Long Evans Tokushima fatty, OLET, rat, an animal model of abdominal obesity with type 2 diabetes. Vaspin has been designated as a visceral adipose tissue derived SERPIN because its structure is common to the serine protease inhibitor family. Rat, mouse, and human vaspins are made up of 392, 394, and 395 amino acids, respectively, and exhibit about 40% homology with A1 antitrypsin. Vaspin mRNA expression in visceral adipose tissue is barely detectable in 6-week-old rats. However, its level increases of age. Pre-diabetic state, in OLET rats, and then declines, diabetic state. Interestingly, exercise and treatment with insulin and the insulin sensitizer pioglitazone prevent the diabetes-related decrease in vaspin expression in visceral adipose tissue. Administration of vaspin to obese mice fed with a high-fat, high-sucrose diet improves glucose tolerance and insulin sensitivity. In contrast to the findings in animal models, plasma vaspin concentration is paradoxically elevated in humans with a high body mass index, BMI, and correlates negatively with insulin sensitivity. Recent studies have reported that plasma vaspin concentration correlates with the presence of coronary artery disease and diabetic microvascular complications. Apelin is a peptide derived from a 77 amino acid precursor, which is processed to several active molecular forms, such as apelin 36 or apelin 13 and apelin 12 in different tissues. Apelin expression has been reported to be regulated by insulin, and it has been suggested to be involved in regulation of glucose homeostasis and obesity. Previous studies have shown that apelin 12 and apelin 36 might play different physiologic roles in vivo compared with smaller isoforms. Apelin 36 binds to the apelin receptor APJ with higher affinity. It has been previously demonstrated that apelin 36 decreases glucose-stimulated insulin secretion in mice, both in vivo and in vitro. Importantly, high doses of apelin 36 have been recently shown to cause moderate increases in glucose-stimulated insulin secretion, whereas lower concentrations of this long apelin isoform robustly reduced insulin secretion by 50%. Taken together, these data suggest that apelin 36 may be involved in insulin regulation and insulin resistance. We investigated the relation between METs and insulin resistance as well as the individual components of METs to adipokines. We measured circulating levels of vaspin, apelin 12 and 36 adipokines, which may reflect different pathophysiological pathways in a population of patients with METs. Discussion. Studies performed during the last decade indicate that adipose tissue is not only site of triglyceride storage but also a source of multiple biologically active mediators, including leptin, tumor necrosis factor alpha, adiponectin, apelin, visfatin, Vaspin, acylation stimulating. Protein, resistin, interleukin 6. Plasminogen activator inhibitor 1. And transforming growth factor beta. They modulate insulin sensitivity and are new therapeutic targets in metabolic syndrome. Adipokines are an exciting new link between obesity and insulin resistance, but also obesity and cardiovascular disease, hypertension, as well as hyperlipidemia. In the present study, we found that there is significant positive correlation between apelin 12, apelin 36, and HOMA-IR levels in patients with METs. Vaspin is a newly described adipocytokine expressed predominantly in visceral white adipose tissues. In several studies, serum levels of vaspin were shown to decrease with worsening of diabetes and body weight loss, whereas vaspin serum levels could be normalized by insulin or pioglitazone treatment. A summary of our current findings is as follows. 1. Plasma vaspin concentration was higher in patients with METs. 2. There were no associations of vaspin with BMI, waist-hip ratio, glucose and lipid levels, and HOMA indexes. 3. Plasma vaspin concentrations show significant association with the presence and severity of coronary atherosclerosis as assessed by CIMT. It is noteworthy that vaspin was significantly associated with HsCRP in our study. This finding is in keeping with pilot data showing that this adipokine may regulate immune responses and inflammation. At present, the role of vaspin in atherogenesis is largely unknown. The expression of vaspin mRNA in periaortic fat cells was recently shown to correlate positively with aortic atherosclerosis. One might speculate that locally produced vaspin affects the atherosclerotic process. Further studies are required to clarify the role of vaspin in the process of atherosclerosis. Recently, apelin mRNA and protein were identified in adipocytes and vascular stromal fractions isolated from mouse and human subcutaneous adipose tissue. Previous studies showed that plasma apelin level markedly increases in obesity associated with insulin resistance and hyperinsulinemia, but others showed no correlation with insulin resistance. In this study, we demonstrated that apelin is increased in overweight subjects and that apelin is associated with abdominal obesity. Furthermore, we found a significant correlation between apelin and IR, which is known as the central core of METs. In addition to our findings, plasma apelin levels were also positively correlated with other cardiometabolic parameters, such as waist/hip ratio, total cholesterol, triglyceride, and negatively correlated with HDL cholesterol. Conclusions. In conclusion, plasma vaspin concentration was associated with the metabolic syndrome and significantly associated with subclinical atherosclerosis. These findings suggest that vaspin may play a role in METs and atherosclerosis. A well-designed, prospective study is warranted to identify the clinical role of vaspin in METs and coronary artery disease. patients with metabolic syndrome had significantly higher plasma apelin 12 and apelin 36 levels compared to control group. Moreover, apelin 12 levels were associated with the number of components of metabolic syndrome present in the patients. Accordingly, the measurement of apelin may be valuable for risk assessment and treatment of patients with METs. So that's all for the day, and please like, subscribe and click the bell icon for more updates.